Maggie. So Maggie's here for her surgery today. I'm going to take this little lump off of her. First I'm going to check her out, make sure she's healthy. This is Laura, my technician. She's going to be helping us today. All right. So one of the things I want to do is listen to Maggie's heart, just to make sure everything sounds okay this morning before we consider putting her out under anesthesia. Oh, good girl, Maggie. Good. She's got a nice normal dog rhythm, no murmurs. Her heart rate's 120. Her lungs are clear. Good girl, Maggie. Pulses are good. I feel a few mats on her belly from being at the lake. We may do a little clipping for you if you want. We'll take some of those off.
Yeah.
Good. Her belly feels good. The rest of her skin and coat is fine. I see no problems doing surgery today. The next thing we're going to do is we're going to draw a little blood from Maggie and we're going to check to make sure that her kidney function's good, her liver's fine, she's not anemic, everything's okay for anesthesia.
Okay.
So we're going to draw blood, we'll send that to the lab, we'll see what that lab work says. I'm going to place an IV catheter for her today and we'll run fluids while she's out, send her home with some pain meds after surgery. And we'll meet with you this afternoon and talk about the results of everything.
Okay.
If there's any problems with her lab work, I'll call you. Otherwise, we'll go ahead and do her surgery today. Laura's going to go over your estimate for your surgery, have you sign in, and get all your contact information so I have it. Go, Maggie. So we're going to bring Maggie out. Maggie's here for her dental and her cyst removal. We're going to draw a little blood from her for her pre-op profile. Good. We're going to take Maggie back to the ward. She's going to wait. Medical record, and we're going to look under the lab and see his lab work. And this is his blood sugar, kidney function, proteins, liver function, and everything's normal in his lab work. So he's okay to have surgery. So we're going to get Bo prepped for surgery. And over here is Bo's anesthesia log and all the drugs that Bo gets for anesthesia. And Jesse's getting him prepared. He's got his IV catheter in place. He's breathing his anesthetic agents, and we'll go to surgery. So before we go in surgery, we put a nice bouffant hat on and some booties. We want things to be as clean as we can when we go in surgery. Glasses so we can see, and a mask. And then we scrub for surgery. We want to get all the germs off our hands. And then we'll put a sterile gown and gloves on. So while I'm scrubbing, our technician is scrubbing Brady, so he's ready. And in surgery, our technician has already set up our surgery, so there's no wasted time that Brady's sleeping and waiting for us. We want to be waiting for him and all ready. So we put our sterile gown on, our sterile gloves, go with our cap, mask, hat, and booties. And in surgery, we have instruments that have already been sterilized through the autoclaves. So a new pack of instruments. So we set up our instrument tray so we know where everything is to find it and use it. At the same time, Aaron, our surgery tech, is making sure that all Brady's vital signs are where they should be. So we have a nice brand new sterile drape. A little towel clamp to hold it on. We take our gauze and put sterile saline on it. We use a laser because it causes less bruising and less bleeding. Makes it easier to do the surgery, maybe even recover quicker. I pick a setting that's best for skin. all sterile and ready to go. So we turn the smoke evacuator on because the laser makes a little bit of smoke. Now we're going to use our laser to make our incision. So we don't actually have to touch the tissue with the laser, it will just separate the tissue with no bleeding. So we get a new package of suture material. This is an absorbable suture material called monocryl. And we'll use this to tie off the vessels that went to the tissue so it doesn't bleed. So we get things tied off, and then go to the other side. So what Aaron has up there is an anesthesia monitor, and the top green line is his EKG. And we also have CO2 measuring how much carbon dioxide he exhales when he breathes out. And we're also looking at a blood pressure monitor and his respiratory rate and a heart rate on it. A trained anesthesia technician who's with him from the moment we start until he's awake and safe at the end. Now it's time to close his incision. Again, we're going to use an absorbable suture material. We're going to bury his stitches or sutures so that he can't lick at them, and there's nothing that has to come out later. If we do a good job, put nice comfortable stitches in, he'll leave them alone. So we'll be reporting to the owners this evening that his lab work was all normal. He did great under anesthesia. They're going to restrict his exercise so he's not too active for a few days. And they live on the lake, so we're going to try and keep him out of the water for a few days. He goes home with a couple doses of pain medication. No antibiotics needed because it was a nice sterile surgery. And that's it. He also got a microchip when he was here so that in case he sneaks off, which he likes to do, if he ends up at a shelter, they'll be able to scan his microchip and get him back to his owners. This morning we also confirmed with his owners that his vaccines are all current and up to date. He's on his heartworm and parasite control and flea and tick control. So he is a healthy and well cared for dog. Alrighty, we're all done. His stitches are buried and everything looks good. So we shut him off, but this isn't where things end. He'll get his nails trimmed, his ears cleaned. He gets a bath before he goes home. Gets sent home with his pain medication, and at discharge his owners meet with one of the technicians and go over all the details of his procedure.